So welcome, everyone. I'm Bob Isaacson, and I'm the co-founder and president of Dharma Voices for Animals. So some of you have joined us before, some of you haven't. So it's great to welcome new people. I see people filtering in now, so this is good. So I'm not going to take a long time introducing our distinguished panel. I'm very excited to do this today. I'm very happy to talk to all of you and to share with our colleagues, our doctor colleagues, about the benefits of plant-based nutrition. So I'll introduce our panel. Start with our board member, Dr. Allan Kornberg, was executive director of Farm Sanctuary. And he's led many animal rights organizations. He's a pediatrician. He ran the University of Buffalo Medical School emergency room. He was an associate clinical professor of pediatrics at Brown University. He's a pediatrician. Let's see what else I want to say. He's vice president, vice chair of the Department of Pediatrics at the University of Buffalo. Done all kinds of work in human rights and supporting people with work with child abuse, and was a leader in that field. There. So welcome to Allan, and then Susan Silver Lane, doctor, graduated from UCLA Medical School, joined Kaiser in Los Angeles as a resident, has been with Kaiser in San Diego, Kaiser Permanente in San Diego for 30 years. Recently retired from her primary care, from her practice. Family medicine is what she practices, and has practiced for 30 years. Has been a vegan for 5 years, and Allan's been a vegan, I think, for 30 years, and Coach Bank for many years. You can talk about that later if you like. So Coach Bank was a monk in Thailand. He has a Ph.D. from, I say it's possibly the top university in Asia. He's pretty modest about that, but it's been compared to some of the Eastern universities like MIT and Harvard and Yale and all that. It's called Chulalongkorn, is the university, has a PhD in public health. He's been our director of our Thailand project, DVA Thailand project, for it's over 3 years now. And so we work closely together. What else do I want to mention? Back to Susan. Susan, did I hit everything that, and Susan's also raised six children. So I don't know how you had time for medical practice, but wow. So welcome, everybody. I think enough for the introductions, and I'm really excited about doing this. So what I'm going to do is I'm going to ask some of the basic questions. So if you're vegan, you'll know the answer to some of these, but you might find information here that you didn't know. If you're not vegan, welcome to our call. You came to the right place. And I hope this is useful to you in making a decision on whether you want to become plant-based or not, go plant-based. So the first question I want to ask our distinguished panelists, what about protein? This is the most common question asked. Now, as a vegan, I know the answer to this one, but a lot of people don't. How do you get protein? And can one get enough protein on a completely plant-based diet? What do you think of that? Susan.
Yes, I get asked this every day. And we live in a protein obsessed nation. And you hear all the time, that we need more somehow we're malnourished. We're not getting enough protein. But actually the opposite is true. Most people get too much protein. And this is a case where if some is good, then more is not necessarily better. The body can only use so much protein, and then after that, the excess will get stored as fat. It could lead to, especially excess animal protein, could lead to some health risks as well. So now people need to prevent a deficiency, people need 0.8 milligrams of protein per kilogram of body weight. So for example, 165-pound person weighs 75 kilograms, and so if you multiply that times 0.8, you're going to get 60 grams per day. And as long as we're eating enough calories with our whole food plant-based diet, we will almost automatically get enough, if not more than that, enough protein. So I always tell people, try to include, at least 3 servings of legumes, which would include, beans, lentils, and peas. It could include soy foods like tofu and tempeh. Also, nuts and seeds and whole grains have quite a bit of protein. So we don't need to really worry about specific, what are called macronutrients, like, are we getting enough protein? Are we getting enough fat? Are we getting enough carbs? We just eat a wide variety of whole plant foods, we are going to get everything that we need. But for extra insurance, I usually recommend that we do get at least 3 servings of beans and lentils and 3 servings of whole grains. So a serving is usually just a half a cup. It's not very much. In fact, I meant to bring a half cup, little half cup, but I didn't bring it. But yeah, it's just very, very small amount. Now, people that are, elite athletes, people who are weightlifters may need more, closer to maybe 1.2 grams per kilogram. And also older adults, we're finding out that they also need more than the minimum. So maybe around 1.1 or 1.2 grams per kilogram of body weight.
All right, good.
That's
okay. Good. Anyone else want to add?
Yeah, I would just add. I agree with all, of course, and well said. I would just add very, very briefly. It's on a just almost any 2,000 plus or minus calorie diet, or sort of a regular normal diet, you get enough protein. There's just no issues. The only people talk about complete protein, since so each species is different, but humans, there are 20 amino acids that make up proteins. I mean, that's true across the animal kingdom, and our bodies can make 11 of those 20, and 9 are essential, meaning that we have to eat them. We can't make them. And so you don't have to eat them all at the same meal. You just have to eat them, over a few days. And so you just can't. I mean, the bottom line is, and Susan went through the details quite well around older folks and athletes and so on. You just can't get into trouble by not getting enough protein if you're otherwise healthy. The only place that I've seen, which is probably not a concern for most people in this webinar, the only place where the protein not being complete is an issue is folks that are eating primarily or entirely a vegan diet and are eating mostly a 1-grain monoculture, which is an issue in sub-Saharan Africa particularly. And so if and I've had conversation with folks at the World Bank about that, who are worried about that issue and think the solution is eating animals. And so we've talked about how, well, you also can have a farming culture that has more than 1 grain. But so the only way that and we're right now, at least I'm in the US, the only way that it's just about impossible to not get enough protein and to not get complete protein just by having any variety of diet. So,
yeah. So thanks to both of you. Banker.
Yeah, I just want to say that I totally agree with Dr. Susan about too much protein can actually be detrimental.
Yes.
You can get acidic, your blood, yes, acidosis with that. If too much protein, especially animal protein, I myself, if I eat too much legumes, then I get indigestion. But just the amount that you said, Dr. Susan, is just right. So I feel personally that 80% carbohydrate, 10% protein, and 10% fat is the right good mixture for me.
Okay, thanks. So my next question is about fiber. So this is something question that we don't get so often, but it's really, really important. So my question is, what is fiber? How important it is, and how do we make sure we get enough? What do you think? Anybody?
Well, I mean, I'll jump. I mean, fiber is the non-digestible part of what we eat. It only comes from plants, doesn't come from animal products. So you get fiber is really important. It's important for health. The amount of fiber one gets from eating animals is 0. So fiber comes from plants. There's while there's some nuance on complexity, as in all things, fiber helps to modulate or better maintain the body's blood sugar level. So your blood sugar goes up and down less when you have enough fiber in your gut. It's also anti-inflammatory, which is hugely important for reducing the risk of heart disease, stroke, and so on. And it's important for moving one's bowels along, for avoiding constipation, which people laugh about, but that's a common issue every place from little kids to older folks, and as we get older, with constipation runs the risk of diverticulosis, diverticulitis, which causes inflammation of the gut. So it allows the microbiome, which may be a question later. The microbiome are, broadly speaking, are all microorganisms in our body. So it includes on the skin, but it really, in our discussion, really means in the gut. And so by eating fiber, we tend to have a healthier microbiome, healthier gut bacteria. It's really crazy important in very many different kinds of ways. And the way you get fiber is by eating plants. Some plants have more fiber than others, but in general, if one's eating a predominantly or entirely plant-based diet, you get lots of fiber. And if you're eating a lot of animals, you don't.
Yeah, thanks, Allan. Anyone want to add to that? Yeah, Susan.
Yeah, so not to get too technical, but I think it's nice to learn a little bit about the microbiome and how what we eat selects for which bacteria are going to be in our intestines. And the reason this is important is that the good bacteria will take the fiber and make something called postbiotics, or make healthy compounds. And one of them is, people might have heard of short chain fatty acids. And it's interesting to see how the short chain fatty acids actually lead to all these health benefits of fiber. And there's all these complex biochemical processes that actually take place. But you can think of them as being the drivers of all of these processes. And the reason that helps me is that I know that every time I put something in whatever I'm putting in my mouth, it's going to encourage the good bacteria to take up shop and multiply. And if I put something more, an animal product or maybe processed food, it's going to select for, quote unquote, harmful bacteria that will create harmful compounds. So just getting a little bit more into the weeds, I really like thinking about how the short chain fatty acids actually turn on and off cancer genes, which I find fascinating. And so, because a lot of times we hear about, oh yeah, fiber leads to these health outcomes, but we're just kind of vague. We don't really know exactly how it happens. But I think learning a little bit more about the microbiome and exactly how it happens, that's where all the magic happens. can be motivating. It is for someone like me. Maybe it'll help somebody else be more motivated to think twice about what they're eating.
I tell my followers, if you don't do number 2 every day, you're having a problem. There's something wrong with you. And if you are vegan, having enough fiber is not a problem at all, because all you're eating is plants, and it's just automatic. Just to add, fiber is also a good prebiotic short chain and fatty acids, and that also reduces inflammation. Diseases of inflammation, we can sit and talk about that all day. Arthritis, strokes, diabetes is also a disease of inflammation. Okay, that's it.
And when you say followers, you're referring to YouTube channel? Yeah.
Yes.
Pretty much. Yeah. Okay. So just as an aside, Coach Bank has about 450,000 followers. Yeah. And you talk about veganism and your.
I talk about veganism. I talk about plant-based and how to prepare. Yeah, recipes. So it's more palatable.
That's important. I mean, communication. So listening to all three of you, and you have, I must say, all three of you have really good ability to speak clearly, so that non-doctors, non-PhDs can understand, which is really critical, because we have people here that are trying to learn as much as they can. So thank you for that. I want to ask another question. This is a big one. So it's really about which diseases are preventable and which diseases are treatable by vegan diet or plant-based diet.
Talk about non-communicable diseases and diseases of overabundance or overconsumption. And so that's, it starts with heart disease and cardiovascular disease, including stroke, and then type 2 diabetes comes in very quickly as well. Some cancers, not all. So those are the main ones where eating, just in terms of both the number of lives lost and sort of quality years of life lost. Those are the biggest ones. There's some association with renal disease, high blood pressure for sure, which is a huge killer, and as people say, a silent killer, but usually associated. So I think that's now. So by eating a plant-based diet, it's not a guarantee, but one's risk of getting any of those diseases is reduced. And then also, if one has one of those diseases, one can see mitigation or reduction in disease progression or recurrence. There's also some evidence around some dementia, starting with Alzheimer's. It gets complicated. Susan can speak to it better than I can. She cares for adult patients, but the two most common causes of dementia are microvascular disease, mini strokes, and dementia itself, like Alzheimer's. And certainly for the vascular side of dementia, diet is usually important. And there's some evidence that for Alzheimer's, as well. And then interestingly, and the last one I would say is arthritis. A less common but not rare form of arthritis, rheumatoid arthritis, which is autoimmune or inflammatory arthritis, is associated there's a positive correlation with both risk reduction and treatment with a plant-based diet. And there's papers just coming out, one which will be out in the next month or two from the Netherlands, which speaks to osteoarthritis or degenerative arthritis, and the kind of arthritis that most of us just get as we get older, and the joints, it's had a lot of wear and tear over the decades. And there's some evidence that plant-based diets are beneficial there as well. So huge. I mean, I think I went through most of them, but it's not a guarantee, but the risk reduction is huge for all of those. So
yeah, no, thanks for that. But I'm gonna ask Bank to mention. Can you mention, if you like, Venerable Lin and his experience with diabetes, and then also maybe and at some point I want to summarize, and maybe Susan could do that. Allan's list. Yeah, go ahead, Bank.
I just interviewed a a monk, a Venerable Lin, to be precise. He virtually killed himself of diabetes through a vegan diet. He had really, really bad diabetes where his blood sugar really fluctuated, really high and really low, to the point one day he said he was going to die because his blood sugar was nearly lower than 40. So he gave me a really interesting story, really moving story about his diabetes and how he overcome it. He was taking a lot of medications, and he stopped all medication after turning vegan. And now he's still vegan, even though being a vegan monk is not so easy as a lay person.
Susan, yeah, please.
I wanted to mention erectile dysfunction as something that can be prevented and reversed. And I think a lot of that, you know, some people may not be that motivated to follow a plant-based diet, but maybe that would be a motivating factor for some men if they knew they could reverse their erectile dysfunction.
We've talked about these are diseases and dysfunctions, if I'm using the term correctly, that there is lots of evidence to support. A vegan diet helps, doesn't completely eliminate the possibility, of course, but helps in reducing the risk of getting a disease. And also, as we heard from Dr. Bank regarding Venerable Lin, who works with DVA, Dr. Bank just did a interview of him this past week, and he's working with us to try to help so many monks in Thailand. There are 300,000 of them, Buddhist monks we're talking about. It's a Buddhist country. DVA is heavily involved there, and he's talking to the monks to try to help them, to try to tell them his story, because so many of the monks have diabetes, especially the ones that are a bit older. So we have heart disease, cancer, high blood pressure, diabetes, obesity, erectile dysfunction, and anything else. That's a pretty impressive list.
But I just want to be clear, so that there's two kinds of diabetes, which I think many people know, but there's type 1 and type 2. When I trained in pediatrics, we called type 1 pediatric or childhood diabetes and type 2 adult onset, although many adolescents now get type 2 from being obese. And so everything we're talking about around diet and the risk of diabetes is about type 2 diabetes. Type 1 is a autoimmune disease. There may be some, it's much less common than type 2, but it's not super rare. I just don't want folks that may have a child or have family who feel like that was related to diet. A plant-based diet can actually be helpful to manage type 1 diabetes, but it's got nothing to do with causing it. So that's just a different.
Yeah, thanks, Allan. Thanks. That's really helpful. Okay, so it's a lot of good reasons to a lot of really good health reasons to go vegan. And and if you're not vegan now, maybe you're vegetarian, or maybe you're not vegetarian, maybe you eat animal flesh and animal products. So just start somewhere. If what you're hearing about health motivates you to change your diet, start wherever you are. Start one day with one meal. Just start somewhere. You go out to eat, go to vegan restaurant or a vegan dish. Just start somewhere. And notice you're not going to, right? People won't see a big effect right at the beginning. It takes a period of time to do this, but the science is pretty clear. At least this is the way I look at it as a layperson.
Can I add one thing? We were talking about chronic diseases, but also if someone might think, well, what is my likelihood of getting one of those? I mean, it may not really motivate a lot of people especially young people, to worry about, heart disease and diabetes. But I just wanted to say that eating a whole food plant-based diet can help a lot of people with their energy, can help their mental health, help improve sleep, help their mood. help them think clearly and decrease anxiety as well. So that's another good
Can
reason.
Can I add weight management?
Yeah,
Yeah, weight management, yeah.
so it's,
Well, they
it's
call it,
all
you
there.
know, the gut microbiome, they call the gut the second brain because it, the gut microbiome, the organisms produce, you know, many neurotransmitters and, you know, more than 90% of the serotonin and 50% of the dopamine is produced in the gut. So,
Oh, interesting fact.
yeah,
Okay.
definitely,
Good.
definitely affects your brain.
Yeah, I mean, I have found what you're saying to be true, what all three of you are saying to be true. So it's pretty compelling evidence. So people listening in, so some vegans are listening in, some vegetarians, some none of the above are listening in. And so you can, you know, just start learning about this. You got a really good start today. It's the first time you've heard about the nutritional benefits, the health benefits of plant-based diet. So there's lots of literature out there, but you have to be careful because there's a lot of bad information out there also. So yeah, this is, I hope we're opening eyes, and please share that with your friends. We're going to, the next question I wanted to ask is, what about the phytoestrogens in soy? So here, I hear stuff about that. What about that? And then maybe a follow-up, is it safe for men to use soy? So, yeah, Susan.
Start with that. So, yeah, a lot of people, I think it's changing because the word's getting out, but even up to a few years ago, people were concerned about soy and that maybe the phytoestrogen, also called isoflavone, which is an active ingredient in soy, could act as an estrogen and could have an estrogen effect on the body and cause breast cancer and also lead to, you know, feminization of men, or men could maybe develop breasts, and it could decrease testosterone and everything else. So all that's been debunked. I think what happened was in the 90s, there were a lot of animal studies showing that there could be a concern, but when they looked at many studies in humans, they found it not the case, and actually soy foods, they found that soy foods actually decrease the risk of breast cancer by up to 30%.
I've heard that too.
Yeah, and for people with breast cancer, it could decrease their morbidity, mortality, and for those could also decrease recurrence for those in remission. So so now a very compelling reason to include soy foods in one's diet. Also, for men, eating soy foods could reduce the risk of prostate cancer. So the common soy foods that we could consume would be tofu and tempeh, which is fermented soybeans, and edamame, miso.
Thanks, Susan.
I would speak from my experience, and my followers were men who consume soy products. They experience less problem with erectile dysfunction.
Mm-hmm.
And the phytoestrogen doesn't necessarily have to turn into estrogen. It can be converted into testosterone as well. If the body, if the body needs it, then it can be converted into testosterone. And people ask me this all the time as well. Would it act as estrogen and promote cancer growth like estrogen. And I tell them that it's a weaker form of estrogen. If you have like 200 parking spaces, and if all of those are filled with xenoestrogen, those are from chemicals, from plastics, from animal products, contain a lot, animal meat contain a lot of mammalian estrogen, which is very bind to our tissues very, very well, because we are both mammals. So if 200 of those parking spaces are filled with xenoestrogen and mammalian estrogen, then you're in bad situation. But if those parking spaces are filled with phytoestrogen, which is a weaker form of estrogen, then you're in better shape. Thank you.
Thanks. So what about B12 supplements? Are they necessary for one who is on a complete plant-based diet?
Yeah, I mean, the answer is, I would say yes.
Yeah.
Just because you can just go, I don't have to worry about that anymore, you know. Otherwise, you have to try to eat fortified, you know, foods, which you may not be getting enough if you do just that. But I've met several vegans, and they weren't taking they just didn't worry about B12, and I tried not to look too shocked, you know, as I sort of gently, you know, recommended that, you know, really should be taking a supplement. So B12, there's nothing, just because vegans need a B12 supplement doesn't mean there's something deficient about, you know, a plant-based diet, as B12 is not made by plants or animals. It's made from microbes in the soil. And so animals they eat a lot of dirt, they accumulate B12 in their flesh. And so when we eat animal products, we're going to get B12 from them. So there's nothing magic about, you know, red meat that it's a good source of B12. So just to be on the safe side, it's recommended that vegans, and actually, I mean, a lot of lacto-ovo vegetarians we're not getting a lot of B12 and dairy and eggs necessarily, but it's recommended if you just take about a 2,000 microgram supplement of B12 once a week, you're fine. People over 65 are going to need more, because as you age, it's harder to absorb the B12. And we just don't want to mess around with B12 because B12 deficiency can have all sorts of neurologic consequences, like neuropathy, cognitive problems. There's a special kind of anemia you can get. And sometimes these can be irreversible. So anyway, people over 65 need 1,000 micrograms a day. And it's recommended to take something chewable. And also something I learned recently is that the B12 as part of a multivitamin supplement may not be the best way to get it, because the vitamins and minerals in the supplement may sort of deactivate the B12 or decrease your ability to absorb it. So
wow.
B12 supplement once a week, 2,000 micrograms. If you're older, then 1,000 a day.
Bank, I want to ask you, in Thailand, is B12 supplement readily available?
It is readily available. I've met animal eaters who have anemia. So anybody can get anemia, not just vegans. I tell my followers to take brewer's yeast, Marmite, Vegemite. Those are fortified foods, or vitamin B12 supplements. But I just read recently in an article that too much B12 can be cancer promoting as well.
So how much?
So I don't remember the amount, but to Dr. Susan, not to exceed Dr. Susan's recommendation of 1,000 milligrams.
And we can certainly have our physicians check our B12 levels periodically.
This one, I got a question. Please explain the difference between vegan and plant-based. So we probably should have said this at the beginning, or I should have said that. So we're using the two words synonymously. They're the same, plant-based and vegan, the way we're using it. So sometimes we say plant-based, sometimes we say vegan. But thank you for the question. It's important to know that. And another question is, this has been on my mind also. Is veganism discussed in medical school? If not, why? So let's divide it up. We have 2 U.S. doctors and we have the doctor, Ph.D. in public health in Thailand. What about in the U.S.? Is it discussed in medical school?
Not much, very little. So it hasn't changed much over the decades. I mean, I left the medical school faculty in Buffalo 2015. I was a medical student in the 70s, and I would say that the more things change, the more they stay the same, let alone about plant-based nutrition. So it's discussed very, very little, and let alone plant-based nutrition. And maybe it's gotten a little bit better, but in the States, but very little, with some exceptions. So not much. I mean, that would be the short answer, though. There's of course a longer answer as to why and so on, but it's not much. Yeah.
Just a follow-up to that, is that a reason, do you think, Allan, or Susan or Bank, you can jump in if you want on this too. I'll ask you about Thailand in a minute. Is that a reason why doctors don't recommend plant-based diet so much? They don't really know about it very much. I don't know. Why is it that we don't hear medical doctors in the U.S.? There's some, of course, like yourself, like 2 of you, like Allan and Susan, but they don't really talk about it much.
Yeah, I mean, I think there's a few reasons. Starting with, I mean, I would guess offer 3 briefly. One is that physicians aren't trained much about nutrition. Number 2, which is sort of kind of related, is that it's not something that's easy for us to do in practice. It's easy to prescribe a pill or to do surgery, depending on one's specialty. And it's not easy as a physician to prescribe a diet. And most people, unless you go in a GI clinic or endocrine clinic for diabetes or that sort of thing, are not seeing a dietitian who actually knows about diets. So we don't know much, and we don't have the tools at hand. And maybe the third reason, those are true. I mean, I think those are maybe not facts, but close to facts. I think the third reason, which is more conjecture, but 98, I don't know, maybe 95% of physicians in America roughly, eat animals, and maybe 2% are vegan or plant-based. So, there's this kind of cognitive dissonance. I'm a good person. I'm a good doctor. I'm a healthy person. I eat double bacon cheeseburgers. That must be okay. So I'm not really going to talk about it to my patients very much. Would be another reason, perhaps.
Mm-hmm. Susan, you want to add to that?
No, I agree. I agree with all that. I think also doctors, they may not know how to talk to the patients about it. Let's say the doctor is plant-based. Hey, you should do what I'm doing. You need to do this to, decrease your risk of diseases or to reverse your diabetes. And that may not be the best approach, because it may make the person feel bad about themselves. They might feel like they're being shamed. And I think that, more of a compassionate approach. Doctors may not have that much training in something like motivational interviewing or, trying to affect change in their patients. And the issue of time is a huge one, because we can tell patients, hey, here's a handout, you should be eating this way. I think that that's not being done, but it takes so long to explain all this to patients. And but even just a referral to, you know, a dietitian that would be able to do that would be beneficial, or just letting the patients know that this is as important or more important than this pill I'm going to give you. But I think it just takes a lot of effort, a lot of time. But they do need to hear it from their doctors, because if they're not hearing it from their doctors, it's like, well, the doctor didn't say anything, and I can't blame the patients. You know, there's a lot of confusion.
Yeah, that's why I appreciate so much what you're doing in Allan for so many years, talking about this. Yeah, it's really, and we're looking for doctors right in Thailand to help us out. There's a few vegan doctors there, but it's hard to find.
Very few.
Yeah.
I cannot answer this question directly, but I can, talk about my doctor friends. Most of them are not vegan. Only 0.5% of doctors in Thailand vegan. They believe that animal protein is the best kind of protein, best quality, and they love egg whites. It's their go-to. If people talk about animal protein, then they stop eating meat, but they just keep the egg whites.
Lots and lots of eggs. I was so surprised when I went there. I mean, some of the monks are eating 5, 6, 7 eggs. Oh my!
A day.
A day. I know. You put it up there on your PowerPoint. It's it's a health issue. I mean, I can tell as a layperson, you know.
And I do want to add, since I know that this talk is sponsored by an organization which I'm a part of called Dharma Voices for Animals, that we are talking about human health. And so that while from a human health consumption point of view, it's arguable if having an egg a day is bad for one's health or not based on one's full diet. Having 5 or 6 or 7 eggs a day is clearly not healthy. So, but having said that if one is eating the whole egg versus just the egg whites, and again, I'm talking about human health, that egg whites are not a health issue like the whole egg and all the cholesterol and fat in the whole egg. So just to be clear about that.
Good. Thanks, Al. Thank you, Allan. Suzanne.
I also want, going back to one of the questions, what's the difference between being vegan and plant-based? I just want to clarify that vegan means that you don't eat any animal products. But you could be an unhealthy vegan. You could be eating French fries and soda and Oreos. Those are all vegan foods, or a lot of highly processed, you know, vegan foods. And those are not healthy. So what we're talking about is whole food. I think we all call it whole food plant-based. So unprocessed whole foods. Yeah. And versus vegan is, so whole food plant-based is vegan. It's under the category of vegan, but you can be a vegan and not consume a healthy whole food plant-based diet.
Yeah.
Yes, definitely.
Susan, I agree with you, of course, that's well said. I would add, in trying to not dive too deeply on this, but that I use the terms, what you say is true. I also use the terms depending on my audience, so that if I am talking to physicians about human health, I talk about plant-based, because that tends to be seen as non-controversial and worth hearing about. And if I'm talking to animal advocates, I'll use the word vegan. If I say the word vegan to physicians giving a talk, immediately, oh, you're one of those, you know, you have a agenda which is not about human health. So I mean, that is real, at least in the US. It's translated elsewhere.
That's really important.
When talking to monks, we don't want to pass that message. Definitely.
Yeah, exactly. We have it's different in every culture and in every country. But thanks for clarifying that in the US. And I think that's my experience is the same as yours regarding that. How it's really important to have choose the right description, either vegan or plant-based. Okay. Anything else on that? We got looking see if there's any more questions? Here we go. Questions. So let me ask you this. I'm looking at a question in the chat room. Yeah. So this is just a comment about thank you for your last comment, Susan. So I'm going to go to the next question. Are there public health benefits to a plant-based or vegan, we could say, diet, as well as the individual health benefits that we've been talking about? Public health benefit.
Well, there's a bunch. I mean, there's so while it's, starting with infectious disease and pandemics, while it's unclear where COVID came from, it may have, it started in Wuhan, China, whether it started from a live market or it started from the virology lab there is unknown. But in general, many human infectious diseases and pandemics have come from our slaughtering and consumption of animals, both wildlife and factory farms, and also as we deforest, as we destroy more of the planet's vegetative surface, more wildlife comes closer to human populations, and that increases the spread of infectious disease. So there's a huge public health perspective from there. Number one. Number two would be about, in the US, about 70% of all antibiotics used in the US are given to animals on factory farms because the conditions are so horrible. That doesn't mean that 70% of antibiotic resistance comes from factory farming, but antibiotic resistance and our species dying from an antibiotic that doesn't work anymore is a real issue. And these drugs being used more to poor animals, to have them raised to grow faster because they're in horrible conditions, is a cause to some extent of antibiotic resistance. And number three, depending on, you want to call climate change, some people would say climate crisis, that gets very political very quickly, but animal agriculture is certainly a component of greenhouse gas emissions, and that's arguably a public health issue as well. So I would say those three come to mind immediately.
Yeah. Allan, thank you for mentioning that. And I want to say, in addition to that, we the DVA looks at our mission threefold. Talk about compassion for animals, and that's really how we started. And it just horrendous what happens to animals on their way to our plate, or under giving milk and eggs and all the other things that animals have to give up to feed some of us. But also very important, Allan mentioned, is global warming and environmental issues. And it's absolutely clear that plant-based diet is the way to go if you care about the earth. And now we're also talking about health, because of course people care about their own health, the health of their children. So we really come at it from three different points of view. I'd say we stress compassion because this is the foundation of DVA. We came together because the Buddhist message is so strong about compassion for animals. And there's almost 1 billion Buddhists, we believe, an estimate of how many there are. And so many of them are eating animals, eating animal flesh. So yeah, thanks for clarifying that. Anyone else want to talk about this or comment on it? Yeah, Dr. Bang.
No.
Oh, you don't? You're going like that. Okay. You have to be careful when you do that. I say, okay, you know what an auction is? There are auctions in Thailand. Yeah. So some people go like this, like they're saying hello to a friend. They go, sold for 10 million bahts. And all of a sudden you got to pay for this. You don't even want it. So you know what I mean? Anyways, next question I should have here.
Dr. Susan wants to say.
Oh, Susan, I didn't see your hand.
I just want to say, really, like, as far as an epidemiological effect of this, because a lot of times people will say, well, my grandmother ate bacon every day and smoked and she lived to be 95, but we're talking about like decreased risk of cancer and heart disease and diabetes in the individual person. It may not make necessarily affect them, but over the taking millions and millions of people, all the lives and suffering that could be, say, you know, reduced and
Yes.
say
And
the
and
cost.
next door, yeah, and next door was vegetarian. She died of cancer.
Right, and so, yes,
I hear that all the time.
so being, right, so there's a book after Michael Greger wrote his book, How Not to Die, and then somebody wrote a book, Even Vegans Die. which I
Yeah.
thought, you know, so it's like, it's all just sort of percentages and risk, and, you know, any one of us could still have heart disease and cancer, which just overall, we're doing whatever we can, we're reducing the risk. And so, putting another way, like, let's say my risk of, I was just reading that a quarter cup of consuming the equivalent of about a quarter cup of milk a day could increase a woman's risk of breast cancer by 30%. Sounds like a lot. I mean, over a population it is. But let's say my risk of breast cancer is 3 out of 100 right now. If that risk goes up 30%, that goes to 4 out of 100. So someone, you know, if you have a low risk of something, increasing the risk by 30%, still you have a relatively low risk, but over the course of millions of people, that could be many lives saved.
Yeah, thanks, Susan.
Yeah.
So let's see, how we doing for time? Well, actually, we are out of time. Why don't I do this? So we don't have to stop exactly on the hour, and I think people would appreciate is there anything, I'm gonna go around, is there anything that you want to add, kind of like a concluding remarks? Let's just go around the clock, starting with Allan. Is there anything you want to add? You don't feel obligated to add anything, sir?
Yeah, I'll add 2 brief comments. The first one is on B12, because we've talked about it a lot, but it's really, really important. And while my colleagues on the panel gave an awful lot of high quality scientific nuance, which is useful. Bottom line, if you're eating a 100% plant-based, eating a vegan diet, just get B12 from someplace, and it matters less net where you get it from than that you get it some way, somehow. And when people say, well, I should be able to get it in nature. Well, you don't live in nature. You know, you live in Bangkok or live in San Diego or live in Boston. And if you live in Boston like me, not where you all live, vitamin D, vegan or not, is the other thing you should think about in terms of a supplement. So that would be my one-on-one supplement comment. Just keep it simple.
Yeah, no, thanks. Thank you very much. That's really helpful.
And my second comment, which is just adding on what Susan said, is that this is all about, from a health point of view, there are obviously environmental and ethical perspectives here as well. From a health point of view, this is all about risk reduction. It's about improving the quality of the lives for ourselves and our loved ones and the length of our life on average. One doesn't have to be perfect. When I go out to a restaurant, I still eat vegan, but I'll eat a fairly unhealthy meal sometimes because it's like fun to do and I enjoy it. And you don't have to be perfect. Just eat a plant-based diet entirely, or at least mostly. Have it be mostly whole food or limited processed food, but it doesn't have to be entirely so. And if you eat a mostly plant-based diet, the likelihood for yourself and your family is you're going to be healthier and live longer on average.
Yeah, no, good. I find that helpful. That's how I try to live too. Thanks for saying that. Hey, Dr. Bank.
I say to what I say to my followers: if you have severe diabetes or severe cancer, I would recommend you to run to herbs. And if you are vegan, then you are more likely to consume herbs. Especially, there are a lot of research out now about tropical herbs and Thai herbs like galanga, ginger, finger root, things like that are very, very anti-inflammatory.
Yes.
Extremely, extremely good. So run to herbs if you have a severe. Also, a bitter melon. Have you heard of bitter melon? Bitter, small green really, really bitter. Really good research from India says it's really, really good for diabetes and reversing beta cell death, beta cell function of the pancreas. When I read that, I was really, really shocked.
Yeah, thank you. And I was, it's very interesting to me because there's so many different, there's not just medical doctors in Thailand, of course, as you know. There's a lot of Ayurvedic doctors, and we work with one in particular quite a bit. We work with her a lot. And also both Thai medicine doctors and Chinese medicine doctors, and they talk a lot about herbs, and it's not only Western medicine. And this is also true in the other countries you work in, Vietnam and in Sri Lanka. So, thank you for adding that. I know I've watched your presentations, a number of them, and I know you have up on your on PowerPoints.
Yes.
Herbs. Yeah, absolutely. Yeah, thanks for adding that. Susan.
Oh, yeah, I would like to thank Dr. Michael Greger for his work, and he is the person that convinced me to go plant-based 5 years ago. Somebody told me to check out his website, nutritionfacts.org, and I watched one of his 1 hour kind of summary talks about, the talk was, called How Not to Die. And I just couldn't be in denial any longer after watching that. And being the kind of all or nothing type person that I am, I went plant-based like the next day. But he also helped me with that because he has something called the Daily Dozen. He has an app called the Daily Dozen, and it tells you what to eat to kind of make sure you get everything you need. And I was sort of mentioning it before that, at least 3 servings of beans and lentils and 3 servings of whole grains. And he tells you what is included in that category: a 1/4 cup of nuts and seeds, your B12 supplement, 5 servings of vegetables, at least 1 or 2 cruciferous and at least a couple green leafy, and just things like that. It was so helpful for me. It enabled me to overnight to become, I already was lacto-ovo vegetarian mostly, but I was getting my protein from most of it, from dairy and eggs. And I wasn't really accustomed to eating a lot of beans and lentils. That was a big change for me. But yeah, and then I I got too enthusiastic about it, and I started telling everybody about it, and I probably annoyed a few people. So that I had to, kind of calm down a little bit. And
we've all been there. So
yeah.
We'll never calm down.
My brother is also family medicine. It's a funny story, family medicine physician. And of course I told him about it, and he was like, okay, I'll try your plant-based thing. But when I see you in 6 weeks, I'm only going to do it for 6 weeks until Thanksgiving. And then I saw him at Thanksgiving, and he said, I'm living the dream, and he said it completely transformed his life. His whole family went plant-based. He started telling his patients about it. It reinvigorated his life as a doctor. And so yeah, had an influence. Thank you, Dr. Greger.
Yeah. Thank you, Dr. Susan, for sharing that. And I'm just going to mention Dr. Greger is a significant supporter of Dharma Voices for Animals. And we appreciate everything that he's done, as we appreciate everything that Dr. Kornberg, Dr. Banks, and also Dr. Lane has done for us and helping us, all members, and doing significant things on behalf of DVA. So with that, I hope this has been useful and informative and interesting to all of you. And we're going to be posting this on YouTube. We're active on Facebook, also Instagram, and our website, and we send out a newsletter. So if you're not a member of DVA yet, just go to our website, join DVA, become a member, And it's very simple. Takes about a minute and a half to fill out about 6 fields there. Give us your name and your email address. You can become a member and find out about these events. So thank everyone for joining us. This was great. I really enjoyed it myself. Take care and please stay tuned. We'll keep joining you. Bye, everybody.
Bye.
Take care.
Bye bye.
Bye.